another Pineapple series brought to you by GrenCHAP. If you've tuned into one of our talks before, then you know that this is where we get down on the ground, speaking to professionals in respective fields about social issues that are affecting members not only of our community, but other marginalized communities on Ireland. If this is your first time, then I want to extend a hearty welcome to you. And tonight we will be talking about women, COVID-19, and sexual reproductive health issues. Your host, my name is KizzyAnn Abraham. And on the panel tonight, we have with us Shakey Cornwall, Dr. Tonia Frame, and also Dr. Sonia Nixon. I will ask each panelist to just introduce themselves briefly so you have an idea of who they are and the knowledge that they'll be bringing to tonight's discussion. So without further ado, Shakey, can you just introduce yourself? You'll be followed by Dr. Frame and Dr. Sonia Nixon.
Right. Thank you so much, KizzyAnn, and a pleasant good day to all of you. And thank you so much for having me on the show. And so my name is Shakey Cornwall, and I am a counseling psychologist. And I've been working in that field for over 10 years. And I do my primary work with a clinic called Legal Aid and Counseling Clinic. And we do a lot of work around gender-based violence and other mental health issues. And one of the unique things about, our clinic, while it might be referred to as legal aid, it's not the traditional legal aid and counseling clinic. Because as a psychologist, I work within the psychosocial component. And so we offer those kinds of service to a wide range of clients. And I look forward to our discussion and engagement today.
Dr. Frame?
Good evening, everyone, and thank you so very much for having me, KizzyAnn and GrenCHAP. I am by profession a public health professional. I lecture as well as I do consulting. My substantive background is in sexual and reproductive health and rights. And I do quite a bit of work around adolescents, sexual and reproductive health and rights, as well as around, most recently, gender-based violence, an issue which is quite pertinent during this pandemic. And yeah, that's it for me. And I get to add that I'm also, I try to do some work with GrenCHAP. I'm one of the advisors to the board. So I am very happy to be able to have this discussion with these wonderful ladies that I know here tonight, Shakey and Dr. Nixon.
Okay, thank you, Dr. Frame. And the lovely Dr. Sonia Nixon.
Well, good evening, everyone. I see we're going in order of seniority. Thank you. I recognize this since I'm the oldest person on the panel. It's a pleasure to be here, and I want to thank GrenCHAP and other sponsors for inviting us. I too am looking forward to working with Ms. Cornwall and with Dr. Frame. So I'm a general practitioner, a very long history, and I also have a degree in public health, specifically in global health and in human and social behaviors. I am looking forward to the discussion, and I want to thank you guys for actually looking at this, taking this kind of perspective on issues of women, especially in this COVID-19 panel. I anticipate a great discussion, and a lot of information will be shared tonight with our brilliant public. So thank you.
Okay, lovely. So many persons might be wondering why the gendered approach to this. So for those of you who normally tune into our page, you would know that a few weeks ago, we would have covered a session on men's health issues. And this session is specifically targeting women. And the only response to that is that when it comes to health issues and biology, men and women are different. And so there are specific health issues that the male sex is challenged with versus what we as women and girls are challenged with. So that's the only separation here tonight, biology. So I'm going to jump right into the discussion. And Dr. Frame, I'm going to call on you first. what are some of the main health problems that you have observed that are specifically affecting women and girls during this pandemic? We've been living with COVID estimately for the last 2 years. Have there been any specific health related issues that have been under the spotlight during COVID as it relates to women and girls?
Right, thanks, KizzyAnn. So while I cannot speak definitively, let's say for Grenada, and what the specific health concerns that women and girls might be affected by during the pandemic, what I can say is that many of the pre-pandemic health conditions that women and girls were faced with, those have not gone anywhere, right? They are actually stayed right here with us, and in many regards, they've gotten worse because of access to health care and so on. So the typical issues for girls would be like anyone, your chronic conditions. Those are the top causes of sickness and death in Grenada and globally, and in Grenada it's cancers, right? So those haven't changed. Now I cannot tell you specifically what the numbers are, but what I can tell you is that in my assumption, I guess, or estimation, I would say that those probably would have worsened because women and girls have not been able to, or even in cases where they have been able to, they are afraid to access health services, the regular health services for their, to check their diabetes and their hypertension, have their breast exams and mammography and those kinds of things, their pap smears, because of fear of contracting COVID-19, right? And in some cases, because of the lockdown, those services were not available, right? As healthcare providers and the healthcare system in general was trying to figure out how to make those services available. And then the other thing is that if we're speaking specifically about the sexual and reproductive health issues, then generally during pandemics and other types of emergencies, those problems are not prioritized. So very quickly, as the health system need to deal with, let's say COVID, that's where we are, right? They need to deal with COVID, they need to direct all of their attention there, right? So we're not seeing the focus on those chronic conditions, on those sexual and reproductive health conditions. And so for those reasons, they worsen in number, right? So in quantity and even in quality. Because where women would have been screened earlier, now they're gonna probably be screened much later, right?
Okay. Dr. Nixon, can you chime in here on pre-COVID-19? What are some of the types of cancers that were specifically affecting women?
I want to be a little more general than that, and to complement what Dr. Freeman said. So as like I say, on Christmas 2019, before we even knew, was 5 days before we would find out about this COVID-19 pandemic, well, the epidemic that started in Wuhan and grew into a pandemic globally. We had a system, a public healthcare system, what we all know, a primary healthcare system, and even a secondary healthcare system that had its own challenges. We had a paucity of staff, less than 400 nurses for the 100,000 of us. We had, some relative inaccess. So when it came to like tertiary care, for example, cancer is the #1 cause of death among our population. Well, until Corona came the other day and kind of bounced it all just for this year. But cancer is the #1 cause of death. But we don't have any radiology, we don't have any radio treatment. So you can't get radiotherapy here in Grenada, it'll have to go away. So that's what exists. Often we have to import some of our chemotherapeutic drugs, the thing you give people by mouth or in their veins to treat their cancers. Even some of our diagnostic methods are still relatively not, you know, as highfalutin. We don't have access to MRI for everybody. A lot of women, especially the working class women, the majority of our women do not really have free access to getting mammograms. But breast cancer is the #1 cause of cancer death in women, right? And my usual example is a woman with 4 children who's probably a single mother who earns $250 a week. Even if she earns $300, she probably doesn't earn much more than that. But she earns it because she comes to your house and does your laundry today, tomorrow she cleans mine, following day she goes to Shakey's, and it goes like that. Every day she earns, let's say she earned $80 for the day, or $100 if she have a really kind employer. A lot of us not like that, okay? She goes, she takes some of that money, some of it she buys so she can make dinner for the children and breakfast in the morning. There's school money, there is bus fare, there's lunch fare. She put away a little bit for her susu and for her rent, okay? There's light bill, and you need to have a phone, okay? So she can buy a little credit. Still have to pay bus for herself. She hasn't bought anything else. I can't ask her to do a mammogram for $250, okay? It would be nice to have her. So I have to give her other skills in order to be aware of her challenges for having breast cancer, and to be able to understand her body well enough so she can see early signs, and where possible, try and mobilize for this woman to have access, you know, 40-year-old to have access to having regular mammograms for screening for breast cancer. So those are the challenges we've had before, okay? And my Dr. Frame said, you know, we don't have a lot of numbers yet, because I was actually trying to get some numbers. We don't have a lot of numbers because I think we have we're so short staffed when it comes to who manages data, etc. It's the same person managing data, managing the coronavirus crisis, and on. So priorities are in place at this time. But we don't know a lot of what's happening. We're not so sure as to how much more women are affected directly. We can say what we saw. So for example, we know that women have what we call better health-seeking behaviors. That a woman will go to check their pressure. Well, they talk to their girlfriend if they're under stress. They will, so we have less suicides among our women. They will talk to their pastor or somebody, that they probably quicker go to the clinic, try and make a time to go to the clinic. Even if it means that nurse is going to just examine the breast, try and get a pap smear as long as they're reminded, check the blood pressure, get their sugar medication. Even if they might take it, not every day, but they will, you know, they'll go make sure they have their pressure medication. They might share to their girlfriend who don't have none, or don't have time to go to the clinic. But generally, women tend to go out and seek intervention for their health challenges a little earlier than the other sex, right? So those are some of the things we have to take into consideration, especially when we get into the coronavirus situation. It means that if a woman is accustomed to doing her usual stuff and we lock down the place, which I'm not saying there's anything wrong with it, because I think those are correct moves, right? But she doesn't have access to go into the health center, simply because most of the nurses are mobilized into more emergency situations, helping to screen for coronavirus. Yes, and we try and do antenatal clinics, but you probably still miss some of the things, right? I don't know what has been the outcomes for antenatal issues, whether, you know, premature births, any neonatal deaths, any maternity deaths or maternity morbidities. I'm not sure. There's no numbers available. I can tell you, there are no numbers available yet because I've asked about it. But those are the challenges that we actually face, right? A woman has to wait until she's in labor, what we call head-on perineum, baby's almost there, to get into hospital, before she would wait before she goes to the hospital. Because even if you feel that you're in labor, I had a young friend who I was advising, go to the hospital. She said, I said, go to the hospital, and she didn't. And by the time she got to the hospital, she was already more than 50% dilated, okay? That puts a baby at risk to be in a birth passage all this time, right? Luckily, her memories weren't broken, but it does put the baby at risk for unfortunate outcomes. So what it meant during Corona is decreased access to the regular things that women and girls will have access to. But not only that, because women tend to be the ones who earn, we have mostly women-headed households, right? Mm-hmm. So they are the ones who bring in the income. Last month, stores were shut down for a whole month. I don't know if these women got paid, and they have 2 and 3 children, or even 1, right? Stores were shut down for the whole month. Where's the money? Do we go to ramen soup and sugary drinks for our children, what do we give them? Crackers and macaroni and cheese. Well, pseudo macaroni and pseudo cheese. What do we give our children? So then the nutritional component of it, okay? That's very important, because a woman's nutrition is very important for her childbearing, especially younger women, okay? We know that women have sought more vaccines than men, because women have better health-seeking behavior, okay? We know that more women, however, were tested positive. Guess why? Because for the same reason, they're the ones who went in and got screened. But more men have died of coronavirus. So the women have done what they had to do despite all the difficulty, okay? They have gone through the anxieties and the depressions and the hunger, because they've gone through the issues of physical abuse, sexual abuse, which is kind of not my area, but it is part of health, because at the end of the day, when you look at it, these women are going to have sequelae at the end of this coronavirus. You're going to have girls who have been abused, who are going to have to take that through their lives, who probably don't have the guts yet to speak about it, and will have all the physical outcomes to their health that they really shouldn't have, but simply because you've had a coronavirus.
Thank you, Dr. Frame. Thank you, Dr. Frame and Dr. Nixon, for highlighting that we have not really seen the big picture of exactly what we're dealing with, but we are fully aware of the challenges that existed, and common sense would tell us that these are only being exacerbated right now. So Shakey, I want to actually pull you into the discussion now, because Dr. Frame touched on it with the anxiety and the depression. And I think in our culture, we have this idea of the strong Black woman. And evidently, if we look at the social issue of suicide, all of our cases just within this COVID period have been among men. And I think, yes, although it has highlighted that there is a mental health crisis and an issue with that sex, at the same time, how does this image of us being a strong Black female, being the breadwinner in the household, being the one who everyone is depending on, are we stretching the rubber band beyond a stretch right now with this idea? And are we going to see suicides among women increasing, or what do you foresee with all of these challenges and women's mental health?
You know, and I suppose similar to what we're seeing in the health sector in terms of some real challenges existing before the pandemic, and it been exacerbated by the shutdown and all the different challenges with the system's ability to deal with what's happening. Similarly, in the mental health field, we're seeing some of that happening, where, as Dr. Nixon mentioned, that we see because of men's health-seeking behaviors and so on, and the outlets for dealing and managing with some of the stressors, that they're, they sometimes are at the headline. For example, the suicides and so on. What we know about women as it relates to mental health, for example, things like anxiety and depressions, women outnumber men in terms of those who are diagnosed. And oftentimes it's because of the same factors. Women most likely would go in to be tested. They will identify issues more openly. They would recognize signs and symptoms, and sometimes reach out for help more so than that of men. And during the pandemic, what we have noticed at the clinic as practitioners in the mental health field is that a lot of the women, and I like the example and that you used with the rubber band. So I want us to think about the woman in Grenada living before the pandemic on a tight rubber band, and then the pandemic came, right? And so with that analogy, we understand that it is natural to see the rippling effect of the people who are surviving, basically. And in mental health, when we talk about surviving, we talk about it on a continuum, like surviving versus thriving in terms of being in a very healthy state. And so a lot of women were already surviving, living as the example that Dr. Nixon expressed about the lived reality of a lot of women is that they live day to day, and they've created mental mechanisms, different mechanisms to allow them to do that. And there it is, right? I'm able to smile today because I know tomorrow I'm going out and make $1, right? I'm able to smile today because at the end of the week, I get my little paycheck, And all this uncertainty has come into the mix for a lot of these women. And now they have to restructure a system that is already traumatized for a lot of them, because we know the realities around the women's experience in Grenada, experiences of childhood, adverse childhood experiences and so on. And now they have to kind of reshuffle. And so you see women who've had, just by virtue of the stress that they're experiencing right now, shutting down. And you see sometimes all traumatic things come into play. For example, I had this client who came in, and her thing was that she was triggered because of the stress that she's experiencing now and the uncertainty. She went back all the way back to Ivan in terms of how she's feeling and all the symptoms that she was experiencing, because this one on top of that one just caused her to flip. And so you see a lot of that happening, that this stressor triggered a number of other old incidents. And so that's the relationship that we see with anxieties and depression as it relates to old triggers, old things that have not been resolved and processed, and they're now showing up. And so it's not that they knew that these things are not there, but this is just pushing it over the lid, over the top, so to speak. And so we're seeing women, coming forward. And I don't want to minimize, and suggest that, persons were not coming forward before. I mean, over the last 10 years, you've seen people reaching out for help, reaching out for support. But when you look at the intensity and the frequency of some of these symptoms that they might have been reaching out for, you definitely see an increase in them. Some of the, what we call psychosis, some of the delusion, some of the hallucination, some of these things were relatively lower in numbers before, but you're seeing a lot of young teenagers coming in with that. You're seeing children coming in with that. You're seeing women as well, and to some extent men as well, coming in with some of those. I don't want to say new, but it definitely was not a big part of our daily client issues coming in on the for interventions. And so it is something that we need to red flag. And clearly, we also know that there is a correlation, because we're on the topic of COVID as well, that stress, our immune system, and how, stress can definitely impact that. And so it makes sense for us to see some of those things happening. And it also makes sense for us to, go back to the drawing board as it relates to interventions and support for our people around these things, because it is real. And so it's not just the traditional health issues, but also the mental health issues, and also prioritizing that in a way that we can help persons to move away from the survival kind of system and create healthy wellness and move into a place where we're thriving and we're doing well. And we have systems to support us. And we need to do if we're going into that, danger kind of space where.
Shakey, I just want to ask you to just share on, for someone who is not versed on mental health issues and what the signs and symptoms are, and for someone who might be struggling with depression, what are some of the signs and symptoms that you can highlight that, okay, this means it's not just me, but this is me having a mental experience? Right.
And so if we think about the rubber band again, and think about a continuum of normal emotional situations and going all the way to abnormal in terms of a continuum, right? And so the average sadness is a very normal and healthy emotion, and a healthy person will experience sadness. For example, anxieties or being anxious or fearful is also a very normal emotion, and the average person experiences it. And so you think about normal in terms of another person going through a very similar situation might most likely experience those kinds of reactions, right? So we consider that normal. So I feel sad, I might wanna, be alone, I might wanna talk to somebody for a couple of minutes and so on. But once we see it moving into becoming overwhelming or excessive to the extent that it is preventing you from doing the things that you normally would do and the things that you have to do, that's a sign, an indication of something for you to pay attention to. And so I feel sad. I lost my mom. I want to be by myself a little. I might take a couple of days off. I lost my mom. I'm experiencing some grief, and it's healthy for me to kind of go through that and process that. But we're talking about a situation where something has happened, and for 3 weeks, I can't move out of my bed. I can't eat. I'm not sleeping. I'm sleeping too much, or I'm sleeping too less, or I've lost my appetite completely, or I'm overeating. those excessive things over a period of time. So we use for depression about 3 weeks. You see that constant, that state, and the symptoms in terms of the frequency is consistent over these 3 weeks, and it's preventing you from doing the normal things that you would normally do. You'd want to check that out because it had moved away from normal to a bit abnormal because it is overwhelming you, and oftentimes you experience distress by it. It's not a state that you want to be in or a state that you desire to be in, but more so it is overwhelming you, and you yourself is also experiencing some measure of distress as an indication.
Okay. Thank
I don't
you
know if that's helpful.
No, very helpful. Thank you for sharing. Dr. Nixon, could you share with us some of, you mentioned that women, of course, were the ones who have, throughout this entire pandemic, have been the sex to exhibit more health-seeking behaviors in terms of screening as well as vaccination. But just for anyone in the audience tonight who has not been vaccinated as yet, or is considering it or has some doubts, what are some recommendations you can share on vaccination and positive implications it can have for the new normal?
So the new normal, I want to start from there, is that most enterprises will require people to have a vaccine in order to come to work, to go to school, to go to daycare, to take care of the kids in a daycare. That's kind of the new normal. The truth is, in the health sector, in the services sector, in hospitality, and a couple other sectors, women are the majority of the workers. Unfortunately, we women are also the ones who earn in the low income range. That's just the reality. But they still form the majority of the health sector, and that is why the challenges with employment became so hard when we were locked down and they couldn't go there and make their daily bread. As we get back to normal and people are re-employed, because I think everybody's back to work now, right? And as we require to be able to keep our women healthy and alive, first of all. We know what we've learned so far from the vaccine is that it is basically safe for the most part. People will have responses to anything that you put into them. That's why the FDA was formed, because everything that is made is considered a toxin. Okay, you have to research it before you can give it to people. We know that the vaccines that we've seen today prevent severe illness. Yes, can you get it? You can still get an infection, but what will happen? Because what has happened with what the coronavirus does, when you inhale it, it likes your respiratory system. So it's mostly go through your mouth or your nose, wherever you take breath in, goes into your lung and attached to cells specifically, because there's a receptor site on the coronavirus that lodges in a very specific place inside your, and that's your lung tissue in particular. Gets there and sends your body makes a response. Hey, there's a stranger hanging around, let's deal with it. Except that the coronavirus makes that response exaggerated. So a lot of the symptoms we've seen with the coronavirus has been because of that exaggerated response, where these secretions called cytokines are produced, and they just produce and they produce and they produce and they do a lot of damage. I'm not going to go into this thing, into the specificity. We also know that people who have what we call underlying diseases, especially like the chronic diseases, hypertension and diabetes, probably 20% of our population is affected by hypertension and diabetes. If you have diabetes, you're quite likely to have hypertension. We also know that people with diabetes actually have greater risk of dying from coronavirus. So if we have 20% of our population with diabetes alone, they probably also have hypertension or high blood pressure, plus other people who just have hypertension. So you have a good percentage of population. We know that our women tend to have more diabetes because of their, we put on more weight and all the rest of it, okay? For the most part, the vaccines have been proven safe, for the very most part. A lot of people are concerned about clotting. But what I can tell you is that that coronavirus, that crazy, drunken, selfish virus that just out to kill everybody, that's his only intention, okay? Actually produces more clotting in the bloods, very tiny clots, which cause, especially the less old population, the younger population who contracts the virus. And that is also the population that moves. You go to work, you go party, you go have fun all over the place. We call it palaver. You're more active. That's the virus that, that's the side effect is from clotting. They get strokes, they get heart attacks, they get kidney problems, they develop diabetes and all the rest. So a lot of people are concerned, oh, I'm going to get the vaccine, going to make clots. No way as the greater possibility of getting clots from getting infected by the virus. Okay. There's a study that they did, and they probably don't know this. Tonia probably can help me out on this one because she does a little more research than I do. Where they were looking at the people who had clots, and particularly from the AstraZeneca vaccine. And they saw that 6 people in a million were who contracted, right? And that 10% of the 6 in a million, they didn't only mean 6. I mean, Europe have a whole lot more than 6 people. And a very small percentage of those, that population would have died. Do we want a population to die? No, but the truth is, within the context of as we are more likely to die from having contracted coronavirus than having taken the vaccine. I personally don't know of any vaccine death. I know there are side effects and people are asked to, watch out for anything strange going on, but I don't know of anybody who's died from the vaccine, but I've seen some very ill people as a result of coronavirus infection. And not only have I seen ill people, I've seen people who, after they come out of hospital and they don't have the virus present in their body, the long-term, what you call long COVID, the long-term effects of it are really significant. The fatigue, the depression, some people with cycle problems, people who have had stroke and heart attacks and that develop diabetes. But there's that thing where they're just constantly tired, and it takes months. Some people take months and months before they get over just that fatigue alone that virus causes in their system. If we were to continue and maintain ourselves in a state of productivity, or even improve to what we had in December 2019, maybe the vaccine is our best choice at this point in time. I would advise women to ask questions. I know that the young women say, oh, they make them bleed. Yes, that research is going on. They have disturbances in their cycle from the coronavirus. They have not seen yet any major problems. They might just have longer cycles or get heavier, but that is being researched currently. Major research is being going on at that. I also know that it was unfortunate because they also showed that women who are pregnant and women who are breastfeeding were at greater risk for becoming very ill, young women, for becoming very ill or dying from coronavirus. One, because already being pregnant means that you have a little more blood cells on things, so blood a little thicker. If you have more clots, you're likelier to die if you're pregnant. And that doesn't really, it takes a little time before your system readjusts to becoming normal again as per the amount of blood cells. Because remember, you're feeding somebody else and you need to have, you need to be in a good state of nutrition and health. And your body, that's how it responds initially, by creating more blood cells and stuff. So we know that being pregnant and the woman in the breastfeeding stage, I guess it indicates the earlier part, are at greater risk of having severe COVID or dying. So.
Okay, thank you for that. I'm glad that you touched on younger pregnancies. Dr. Frame, from a public health perspective, have we seen an increase in the birth rate, or especially even among teenage pregnancies? Have we seen an increase there?
All right. So in this region, I can't tell you that we have seen that. At the beginning of the pandemic, that was what was
concern,
right? So all of the experts,
we were all concerned that with the lockdowns it would mean more time for procreation.
So that was the expectation. that the lockdown would have created the conditions that were right for fertilization, if you will, right? 10 fingers.
Yes.
But while that has happened, there's evidence of that happening in some regions. I have not seen any data yet saying that that's happening in our region or in Grenada. So it's not that it hasn't happened, but so far I've not seen any data that says that has happened. And there are a number of reasons why that may not have happened, right? So I mean, it's a very stressful time, and sometimes, and Shakey can tell you more about the stress response and so on. And some people deal with stress in that kind of way where they need that sort of emotional connection with someone and they get intimate. But a lot of people don't deal with stress in that way, right? They become very withdrawn into themselves, and sex or intimacy just does not fix it for them, right? And then you have other people as well. Dr. Nixon touched on gender-based violence earlier. But you have a lot of situations where people are now confined with their abusers, right? And while that can result in pregnancy, I think the data is just not there to tell us yet if that has happened. We know that gender-based violence has increased, but we don't know for certain yet, at least in our part of the world, if pregnancies have increased.
Okay, yeah. I'm glad that you touched on GBV and that we've seen an increase. What are some of the types of GBV we've seen an increase in? Has it been mostly emotional, physical, a combination, financial? What has been unfolding?
Right. So again, I'm not going to speak very specifically, but I can tell you from what the broader evidence is showing. Is that, for example, emotional violence, right? Verbal abuse, your bullying, and that kind of thing. A lot of online bullying is taking place because now we've shifted from a lot of the physical interaction because of the social distancing to now interacting online. So a lot of that abuse has shifted online or on the phone or however we do that, right? And so remember, when we're talking about gender-based violence, it's not always between partners or people who are dating. In its broader sense, it's just as a result that violence because of someone's gender, right? They're experiencing that violence. So you have the intimate partner violence, which is between the spouses or people who are dating, but you have also other types of gender-based violence. So you have, of course, the physical violence, right? Where a man might come to blows with a woman because maybe she went out and she stayed out too long, right? Or she came home and, maybe she came home a little differently than she left for some reason or the other, right? Or she's talking on the phone for too long, or whatever it is, right? And then you have the socioeconomic violence, which for me is really interesting because of the whole situation with the loss of jobs, the insecurity that women in particular have experienced, right? So they no longer have that kind of disposable income, and not even disposable income, but just income, as Dr. Nixon mentioned, to put food on the table, right? So then you're thinking about, well, how are they making ends meet, right? And they have these children to feed, they have themselves to feed them, right? The GrenCHAP bill didn't go away, right? I'm hearing talks now about how the GrenCHAP bill now seems to be higher than before. So how are they paying the GrenCHAP bill? How are they keeping their phones topped up and those kinds of things, right? So are they engaging in these transactional sexual activity? And not just the women, but their children, right? Because we know that there are instances where women, for lack of a better term, and it does not need to be politically correct. These things don't need to be politically correct, right? But women literally prostitute their children to make ends meet, right? Yes, so we'll say, yes, we have women that are bad and they do it just because. But in most cases, which woman want to prostitute their child, their son or their daughter? It's not just the girls, right? A lot of times when we have these conversations, we focus on the girls. But the boys as well are finding themselves in this situation because they have to help mommy to meet ends meet, right? So those things are really concerning. And then the other thing is, when we're locked down and we're all working home remotely, that's one thing. We're all home, right? So mommy might be able to throw an eye while she's over here in the corner doing her little work on the computer and whatnot. But when things start to open up and mommy now has to go back to work, where is mommy leaving this child? Who is mommy leaving this child with? Right? She might think it's the good neighbor or it's the good uncle or the good cousin, but God knows, you don't know, right, who you're really leaving your children with. But you have to do it in order to put food on the table, right? So a lot of women and families are put between a rock and a really hard place during this pandemic. And it's really, really heartbreaking. And they don't have a lot of...
I see Dr. Nixon has her hand raised. Do you want to chime in on what Dr.
When Tonia finishes.
Okay, great.
Right? And then one of the weaknesses in our system is our social protections, right? So we have some social protection, but there's always room to scale it up and to do better. And because now a lot more people have been pushed into that state of vulnerability because of the pandemic, our social protection now needs to be more than what it was, right? Because rather than having, let's say, 200 people on the seed program or what have you, now you probably need to have 400 people on the seed program, right? Because a lot more families are in a hard place, in a jam, right? The stimulus packages that government talks about proudly, right? Who is really benefiting from these stimulus packages? Right, are women who really need it, and not just women, but families who really need it. Are they benefiting from it, right? Then we don't even talk about our, those populations that we don't want to talk about, that GrenCHAP, stands up and fights for every day, right? Our lesbian, gay, bisexual, and transgender populations, our sex workers, right? Are those stimulus packages covering for the needs of those populations? Are regular social services making accommodations for those populations? Are our regular services for gender-based violence making accommodations for these populations? Right? So
I'm glad that you're mentioning all of this, Tonia, because even without saying that our laws our laws, when it comes to gender-based violence, as we know, they only govern domestic issues between heterosexual, and that's straight couples versus lesbian, gay, bisexual relationships who might be in same-sex relationships. So it's a lot that's being exacerbated. Before I ask Shakey to chime in on some of the things we can do for self-care, Dr. Nixon, could you share?
Yes, I wanted to just elaborate a little on some of the issues, because remember that women include girls, okay? And girls are out of school. And a lot of the education they receive, especially a lot of the section, the family life education, that which engenders sexuality, has been missing for 2 years. They don't understand a lot of issues. Would we, anti-conceptive, issues of abstinence, and we still we live in a society where abstinence is said to be the only thing. You have to be a nice Christian girl, right? And once you start having period, you must not watch boys, okay? Because just the look will cause World War, make something happen, warts grow on you or something like that. But we haven't been able to empower girls about their sexuality and to teach them that there are options if you would, what options you have if you do engage, So we're already behind, and then almost they've already had midterm holidays, right, for this term, right? And kids are just getting back into school. So we really regressed on children's capacity and the opportunities for learning a lot of healthy lives, especially our girls, right? Who's talking to them? We've been talking in the media about GBV, and I'm glad you mentioned that it goes beyond just a husband and a wife. What happened to the nurses who work in the hospital that the men come in and cuss off every day? What happened to the simple interpersonal violence where, because a nurse can't see because it's really crazy and we can only do coronavirus, and you come with a little hangnail and you cuss off the nurse? Or your family died and it's really hard and you think they haven't gotten, it's been very hard. September was the month I don't want to remember, right? When people's family died, right? But I want to go back to the girls. We have to remember that our girls lost a lot in relation to education and understanding. Think about it. A young woman who should have started high school in September 2021 has never met her classmates, because she's never been to school. She don't even know what her school look like. You understand? If she starts in high school or primary school. Those are things that have to do with our social development, how we interact and what we learn from each other. Our girls who are going to high school, adolescents, getting new knowledge one from the other. Kids who come from protected school learn the streets. The kids who come from open, kids out in the community, teach them, the protected children, what real life is about. And we all learn from each other. Our girls miss that opportunity to grow together, and especially to learn to take care of themselves and to learn to relate to each other. What are they going to learn to relate to the boys? Think about it, right? So this lockdown, maybe we haven't had increased in teenage pregnancies, maybe because our lockdown was kind of specific. Stay in your yard. You can't go outside. You have to stay among your family. You can't really migrate. Okay, our lockdown was really very closed. It wasn't like, okay, you can go and I can walk around the road. No, you can't. Remember the first month when we couldn't go to our gates, when we couldn't walk our dogs? Those are mitigators to us going on. And I think we've gotten accustomed to kind of staying home. And I've seen some interesting sexual behaviors where I work. I had to call the security one to say, come separate these two here because we're not going to have a hotel set up in one of the corners of the mall, right? But that's normal adolescent behavior and hormones spilling out after they locked in the house for 10 months, right? So I want us to remember that our young women also have the challenge of girls who have been in school from not having had the education they normally have, not hearing of the experiences of their partners, their peers who know more, who know less, not being able to be empowered to make decisions about their own sexual and reproductive health. That's one of the challenges that has occurred and has been really unfair.
Thank you for sharing that. Shakey, so we foresee a lost generation, I use that word for lack of a better word. What advice can you share with parents who are raising teens, toddlers, young children? What advice can you share with them in terms of paying attention to these interpersonal and social skills that would normally be developed in a school setting, but now you're confined to the home space? What advice would you give to parents in terms of nurturing these skills and not ignoring the importance of them as a life skill? You're muted.
Sorry. Permit me, KizzyAnn, before I respond to that question, there was something that I wanted to piggyback on from
Sure.
Dr. Kareem. And I think it's really important because for a lot of times, as we try to understand this nuance, this phenomenon of violence, and we try to get data to sometimes validate what's really happening. We sometimes miss some elements that are sometimes a bit more nuanced. And so we know for a fact that based on how the body and how the brain works, that sometimes when you're in a dangerous situation, the body reacts and responds differently. And so sometimes people are saying, well, the police are not getting a lot of calls, or as it relates to GBV and so on. but the body has a way of sometimes making certain situations acceptable to survive. And so almost like what I call the pussycat syndrome, like when, for those persons who watch not Tom and Jerry, what's it, Puss in Boots, where you learn to kind of put on a smile, but it's not a genuine smile. What we call, it's not a social engagement. I'm happy and pleased, but it is that I know if I don't smile and I do anything that might cause you to be further triggered, I might lose my life. So I become very compliant almost. And so you find persons literally sometimes bending themselves backwards when they're trapped in violent situations to stay alive. And that sometimes explains why, you know, the lady didn't fight back. So we wondering, but she there and the man beating her and she ain't fight back. She ain't really in danger, man. Because it's that survival defense system that the body has that activates for us to stay alive, for us to survive it. Assess risk in a way that if I retaliate, if I really say what I'm thinking, if I really do what I know is my right to do, is going to cause the situation to escalate. And so I become very compliant. And when things come back to a state of normal, you'd find that these reactions might change because I now have more options in terms of safety. And so sometimes that impacts the rates of reporting, because if I call and report, that might increase my danger. And the body knows that. and it's going to try to keep you behave, hold a little corner. And also you find that there are a lot of the triggers that sometimes are generally present in a society that's open and moving about, are sometimes kind of subdued. Because oftentimes when you think about the reasons why we run at Legal Aid, we run programs for men who are what are considered batterers, in that they were charged or so. And oftentimes when you hear some of the reasons why they would have used violence, it's really around, you know, the food not being cooked, the children not being taken care of, those domestic chores, those things that they understand to be things that the woman should be doing, kind of thing. And when you're in a confined situation where these roles, traditional roles, it's like in your domain. So she didn't go out with her friends. I tell her don't lie with these people. I tell her don't talk, these kinds of things as kind of controlled. And so you find that some of these triggers, so to speak, are kind of subdued. And so it can kind of impact some of the acts of violence. And so if I can jump in now to respond to, some strategies that we can employ, help with parents. And so as it relates to helping children navigate and manage during this very stressful time, I want to endorse, you hear a lot about the opportunity that Corona presented. You hear about the tragedies and we know it, we feel it, but there are also so many opportunities. And for a lot of children, despite the disadvantages that they may have experienced because of this shutdown and lockdown, it was the only time that they really get to spend time with their mother, spend time with their father, spend time with their brothers and their sisters in a very genuine and authentic, in a way. Like almost like, when we had Ivan and people were playing hand games and, doing all those very some social things that kept us sane and kept us, going. And it's kind of like that for some families. And I don't want to, romanticize it and suggest that everybody was, having the time of their life, but it created that opportunity. And for those of us who sometimes became overwhelmed and so on, we can still, kind of pull some of those lessons in terms of, building connection, building places of safety for our children, talking in the morning about, how, what you want to be, what you want to do, and just engaging in a very meaningful way. And sometimes we get so busy that we can't really, we kind of minimize it, but it causes us to really think about, what is important, and what is valuable, and how we can create and carve out time for that. And even as, some of the lockdown restrictions are being lifted and so on, we can really think about how we can foster connection with our children and continue doing some of those things, like having a little games night and having the little, talks and writing little letters to each other and doing different things as a family to build that connection. Because oftentimes some of the issues that we experience post-Ivan, as it relates to, discipline of the children and those kinds of things, when we have less control, less supervision, these are opportunities for us to work on that, because we say without connection, there's no cooperation. And oftentimes we're so busy that we didn't build connection with our children. We want to say, don't do this, don't do that. And we expect them to just magically, because we've said it, to feel the need to cooperate. But what the research around it says that if there's no connection, it's very difficult for people to cooperate. Me and you are doing good. We have a loving relationship. And you said to me, take a glass of water for me in the fridge. No problem. I have no problem doing that because I'm going to the fridge anyway. But we're not doing good. We just had a nasty cuss out. You fret me, I fret you, and we just, you know, and I go into the fridge for a glass of water, and you say, take a glass of water. I say, why don't you go for it for yourself? You know, that kind of thing. It becomes difficult for us to cooperate. And so working on the connection, that's one of the opportunities that COVID has given to us. We get to know the people who we share home with, you know, the likes, the dislikes. You know, we never know that the child could have baked so nice, but look how, you know, she made this, we helped out and we worked on it together, and we made cookies from, you know, coconut in the land, and we make a callaloo fish cake, and we do different things together. And we bonded to the extent that, you know, if I say, we want to do something this afternoon, come home early, she feels within her connection that I want to cooperate with mom. You know, I want a stronger desire to cooperate and work together towards the goals of the family and so on. Mm-hmm. And so I really want to, you know, reinforce that, you know, see it as a time to get to know each other, get to learn how to work together as a family, as different persons who share space and share space well. And it also helps because, I mean, many families are struggling with coping with the loss of a friend, the loss of a loved one. And it also creates an opportunity. And I'm not at all celebrating the loss of someone, right? But I'm saying that it really causes us to think, how am I celebrating the lives of the persons who are alive in my life right now? You know, and see how you can create those kinds of routines around celebrating the people who are around you, calling up your mom, calling up your aunt, calling up your cousin, checking in on them, seeing how they're doing. Those who are alive, trying to, you know, use the hurt that you feel, and oftentimes the regret that we feel sometimes when we've lost someone, about, you know, the ways that we engaged and opportunities that we might have missed, and trying to take hold of some of those while, you know, some of our loved ones are alive. And for those who have gone, you know, sometimes just sitting down with the children and talking about what you miss about Nana, what you miss about, you know, just talking about it and using it as an opportunity to celebrate and connect so that we can start the healing from the loss that we might have experienced during this time, as many persons would have.
Okay. Thank you, Shakey. So families, moms, dads, single parents, it's all about looking for the light at the end of the tunnel and focusing on how do we build stronger, better connections with our children and other persons in the household. We are running out of time, so I want to give Dr. Frame the floor to just speak specifically on sexual reproductive health, in the sense of what advice would you give to anyone, any female, woman or girl, navigating their reproductive health right now, in terms of, yes, we know lockdown has restricted our access to specific health services, to the pharmacy to get our contraceptives, but in terms of now navigating the new normal, so there's no going back. So our old way of doing things, of having the pharmacy at our disposal, having our healthcare practitioners at our disposal is no longer, we're not going back there. But looking forward, how can we develop new strategies to navigate these things responsibly so that we're not having unprotected sex more than we were having pre-COVID, etc.?
That is a very good question, KizzyAnn. I think one of the first things that comes to mind is the fact that maybe a lot of couples, married or otherwise, are what they're not thinking about is maybe navigating safe sex during the pandemic, right? That might not be at the top of their list. When you think about when you might think about COVID separately and think, okay, well, I need to prevent myself from getting COVID, so I wear my mask, I wash my hands, you know, and those kinds of things. And then you think about safe sex, I need to wear condoms, I need to be on the pill, or what have you. But do we put the two together, especially if we're not living together, or if one of us is going out and working? And so we're out there and we have that increased risk of contracting COVID. We get together with our partner, but we're not thinking, well, wait, I was just out there. I was out there a few days ago while this is my partner and I may not be concerned about getting COVID, one of us was out there. So maybe I do need to wear my mask while we're being sexually intimate, right? So I really want us to think about that. Think about how we're protecting ourselves from getting COVID while we are sexually intimate with our partner, right? Also think about if you're on contraceptives or even if you're using condoms, when there are periods of lockdown, do you have enough supplies, right? When you went to the supermarket, did you also pick up a couple packets of condoms with your groceries, right? Did you go and get maybe maybe an additional month or two of pills, of your contraceptive pills, right? And while your healthcare provider may not think about it, may not have offered, right? I encourage you to actively think about ways that you can protect yourself, because one of the things that we're all concerned about, for the most part, we'd like to stay COVID-free, right? We don't want to be out there, and we're still encouraging people not to be out there unless you absolutely need to be out there, right? So do you really need to make that extra trip to go to see the doctor, right? Talk to your doctor about it. Is this something you can discuss on the phone? Is this something that can be resolved through calling up the pharmacy and getting a prescription and, you know, having it filled before you go, and then you just go and pick up and you know, whatever, right? So think about the ways, while the service may not be available, when you interact with the service provider, ask for the service that you need and negotiate that. Right? It's great if these different options are available, but in some cases they're not available. And I really want us to think about how these can be available to us, right? And when we talk about sexual and reproductive health, sometimes we focus on one heavily and not the other. But the issue of antenatal care is extremely important during this time, right? Women who are pregnant, women who are planning to get pregnant, right? Please take extraordinary care of yourselves and follow whatever the schedule is for your visit. Don't miss your visit, because it's still very important for you to have, you know, have access to those services. Right? If your healthcare provider thinks that you can miss it, maybe it's something that a nurse can come to your home to provide it, because of, as Dr. Nixon mentioned, those risks to pregnant women of COVID, it's just high, right? The risk of preterm delivery if a woman were to become infected with COVID and those kinds of things, right? So think about those things. A lot of women are delaying pregnancy, right? But you have to be delaying pregnancy in practice, not in thought, right? So you can't think, well, oh, I don't want to get pregnant, but you're not doing anything to not get pregnant, right? So that is really important. Make sure you have the tools at your disposal to not become pregnant during this time. And if you do become pregnant, ensure that you can access the services that you need. Right? And you know, there are lots of ways that you can stay in touch with your partner during the pandemic, during lockdown, even when you can't visit and so on, right? Don't get sick and then say, well, you're going by, you know, by your boyfriend, your girlfriend, or whatever, better, and give them COVID, right? Especially if they're pregnant, right? So keep these things in mind. Think about when you're sick that, well, maybe it might be COVID, and that you don't want to transmit it to your partner, right? So, I mean, there are lots of different connections, and I think a lot of the mental health connection as well, right? That is there's a strong connection there with sexual and reproductive health and rights. And so I think what I want to encourage people to think about, this is a very nuanced subject, it's not just when you say sexual and reproductive health and rights, it's not just about sex, it's not just about pregnancy, it's not just about, it's just very broad. And a lot of these topics are connected. The whole issue of employment, the whole issue of schooling and dropouts, and just, the social services that we mentioned, the laws that KizzyAnn mentioned, right? Your physical health, all of those factors affect your sexual and reproductive health, right? So if you're not performing well in one area of your life, the likelihood that it could potentially affect either your reproductive or your sexual capacity or your interest or whatever, right? There's that likelihood. But know that there are organizations such as GrenCHAP. We now have the Greater Planned Parenthood Association line, which is fantastic news, right? So we have organizations, and of course we have the Ministry of Health or our health centers and so on that are there to provide us with resources. But maybe the most important thing of all during this pandemic is a healthy diet. For us to eat healthy and to stay well, right? That is going to help us to fight a number of problems, right? So we do need to be very careful about what we're putting in our bodies, so that we can cope with the onslaught of things that COVID has presented that we have to deal with during the pandemic, but also post-pandemic, right? So
thank you, Dr. Frame. Okay, before I wrap up, I just want to ask Dr. Nixon, Shakey, are there any last contributions you want to make specifically to anything Dr. Frame would have mentioned, or just in reference to the whole discussion? Muted.
So age before beauty all over again. I think this conversation could be inexhaustible. There's just so much that we could be sharing with not only the women, but the men, because I think men need to understand why we're different. You said it in the beginning, we really are different. We made up different. And because here we have equal access to health services, a lot of the things do not show up. A lot of the gaps in health services don't show up. But I want to say something though. I think the greatest gift we've had, and I really hope that families, women in particular, engage a little more, has been the internet. TikTok, go to the real talk. We spend time, I like TikTok videos that funny, but I also look for real things. And I wish that families will develop strategies to stay well. Women will understand. Research, everything is here. It's all in this little stupid thing, believe it or not. You go in and you find, you Google it, okay? Look for different health issues, screening for cancers, hypertension, diabetes, how they affect women, how women are not affected. When does a woman need to start doing her breast examination? Does she ever need to stop? When is my mammogram due? When is it not due? Okay? If I'm 18 years old and pregnant, what are my challenges? What are the problems? It's here. It's all in this little thing. What are the problems teenage pregnancies have? Even before I go on and become pregnant, what are the challenges to teenage pregnant? What are the challenges to all the women being pregnant? And I'm sure there will be a few of them after lockdown. Lockdown has been challenging for the most part. But I want people to use the internet because it's been one of the great gifts we've had. And and I wonder what we'd have done without Zoom. Look at us tonight. I don't know where you guys can be in Ohio as far as I'm concerned. But here we are speaking in real time, sharing very important information with our population. And that's a great gift. And I want us to understand how important it is. But think how we're going to keep in touch with each other. A lot of information, although we haven't had it as much here yet, telemedicine. I know that the Medical Association has a small group that is speaking to people about challenges with directly related to coronavirus, which we're going to all find out about because we're going to go into a system and Google it. Go to World Health Organization, go to sites that give you kind of objective information, and instead of TikTok, anything but TikTok and all these foolish sites that we go on that really have confused us and made our lives a little less healthy. Okay. access the services, please, because the services are still there. Call the nurse in your community, call the doctor, go get your pap smear, learn your breast examination, go learn about breastfeeding. How do I manage my pregnancy? Whatever challenges you have as a female, right? And I want to encourage men to encourage their wives and their girlfriends and their daughters to do the things that are necessary to ensure that they continue to be healthy women, okay? And Dr. Frame spoke about nutrition. Exercise is still important. Guess what? You go to the yard and play ring of roses, you know, your children, and learn all the whining games that we do when I was to go to Heinzie school. We go to the yard and whine till teacher call you, right? But that was exercise, and we laughed and we breathed, and we lied on the ground, we fall down, and we play foolish game, moonlight, and all the rest. You can do that to the confines of your yard. You can do that to people who you share space with. And it's a good time to pass a lot of traditional teaching. A lot of children don't know folk songs. I was appalled, right? That they don't know simple folk songs. So those of us remember, it's a good time to pass on traditional knowledge and build family relations again. There must be a good reason why we were asked to stay home. Okay? Learn to talk to each other, learn to understand each other, learn to be tolerant. A lot of things that we can do, right? There's just too much against us out there for us not to remain collected and collective, okay? If we don't maintain that connectivity, we're gonna go through, probably there is going to be 1 or 2 more bouts, you know, and I hope there are policies that will help to mitigate some of the challenges that we experience this time, like ensuring that there's enough food and enough we call it, not, you know, the things that they give when you have a crisis, after a crisis, the R thing, you don't remember.
Ration?
Relief. That's
Oh.
enough relief for everybody, because there are people who have been professionals who could not work just as much as women who are washers, who could not work and who earn fee for service and who have mortgage and who have children as well, right? And women, one of the greatest instruments women have is that they talk to each other and support each other. Let's build back that healthily, better, so we'll be able to transition through any other challenges that we may have, not just from a sexual and reproductive standpoint, but from a gender-based problem where women can strengthen relationships that we've had, not only during our generation, but in an intergenerational way. Thank you.
Thank you. Shakey?
I think for me, it was really a pleasure being here. I mean, there's a lot of information going around. And I think for me, in closing, it's really about, you know, being positive. You know, there's so much going on, so much things that we can cry about, to be sad about. But, you know, and I think Kizzy mentioned it, you know, just look for the cloud, the silver lining behind the cloud, and look for little things like the internet that we could celebrate. Look at little things that, you know, you see your daughter do something funny and silly. You know, if you weren't home, you would not have seen her do it. Some of you got to see your children make their first step, make their third step, sit up, do lots of things that somebody else had to call and say, you walk in, you know, that kind of thing, because you would have been out working. And so be able to just look for these silver linings and celebrate them and appreciate them. Because soon enough, this is going to go its way, and we're going to be moving back into, you know, our new normal. And it would be a tragedy for us to, you know, become so deflated and so broken by it. And that when time comes for us to walk into a new normal, we're broken. So look for opportunities to celebrate, look for things to be positive about. And I want to echo Dr. Frim's comment about, you know, nutrition. That's one of the ways to, because if we're not healthy, we haven't been eating proper things, all the proteins and so on, the brain can't even think positive things. You're going to become anxious, you're kind of funny thoughts go into your mind, and you wonder where it's coming from, because you have not been eating what you need. All right. And so the body starts eating itself, so to speak, or you start getting the nutrients that it needs. So eat healthy, find ways. We don't need a lot of money to eat healthy, right? But you know, your things that are closest to the earth are usually the most nutritious things. And so see how you can get some of those greens and those things and eat and give your children. And you might see some changes in them as well in terms of behaviors and so on. And moving away from all these sugary and processed food. Eat healthy and be positive, and we'll see each other on the other side.
I like that thought. Okay, thank you guys for joining us today for the Pineapple series, and this brings our discussion to a close. One of the first things that fascinated me about sexual and reproductive health was learning that there was a difference between male and female sperm, and that though the male sperm is the fastest, the female ones are the more resilient. So I want to close on that note. There's something biologically distinct about us, and it starts from the womb. And whatever you want to take away from that or not take away, I encourage you to just ponder on it. And as Dr. Nixon would have mentioned, this is our gift. I mean, if you're surviving in COVID, you're surviving the 21st century, this is your information hub. Every and anything you want to know, you can find it here. Just ask Google, okay? Anything concerning women's health, issues that are specific to women and girls, start empowering yourself. Spend a little less time, maybe, I don't know, whatever junk you're consuming, spend a little less time consuming it and start focusing on things that are specific to your health, your well-being. As all of the panelists would have highlighted tonight, we have not seen the big picture yet of what the implications of COVID on our population. We know the challenges we've had pre-COVID, and we are fully aware that this has been exacerbated. So we all need to be doing more to educate ourselves on how to take care of our health, how to take care of the health of those we are responsible for, whether it's younger siblings, children, elderly parents, grandparents. We really need to start empowering ourselves and educating ourselves. So I hope tonight's discussion pointed us in a direction that is going to shed more light. And I really do hope that some of what you've heard has turned on that light bulb and you're now empowered to say, okay, well, I need to do a little more research on this, or I need to ensure that I have a strategy in place to not just make sure I'm wearing my mask, but to ensure that I have my contraceptives, I have my condoms, I have what I need to fully protect myself holistically from COVID, from STDs, from unwanted pregnancies, in situations where there's gender-based violence. Our panelists would have highlighted some of the organizations that they're working with. Many of us are already familiar with GrenCHAP. There's also the Legal Aid Clinic that offers a number of services, not just for victims of gender-based violence, but also persons who perpetrate violence as well. So it's a very holistic approach to health and wellness. You also have Planned Parenthood and Planned Parenthood, GPPA, and GrenCHAP that are now providing a host of reproductive health services, from HIV testing to your pap smear, your breast exam, prostate exams, and these services are available at an affordable rate. You also still have our public health system and our many health centers where you can access these services if you cannot afford consultation fees at a private doctor. But do check out some of these organizations on Facebook. I know Legal Aid, GPPA, GrenCHAP, we're all on social media, and we're just a phone call away if you need to inquire, make an appointment, take it from there. So without any other delay, I want to thank Dr. Nixon, I want to thank Dr. Frame and Shakey. And Dr. Nixon, it was not done by age. I actually did it by alphabetical order. And N just happens to be the last letter. So I want to especially thank you guys for sparing time tonight to just speak to our audience on these issues. And we look forward to engaging in the future again. So from GrenCHAP, good night and thank you.